materials, considering education level, making pamphlets and brochures simple, easy to read, considering sensory deficits for people who are hearing impaired or blind. And most importantly is to involve the patient in the goal setting, decision making and treatment planning, and discuss with them their socioeconomic status and resources available to them. It's important for the clinician to have specialized knowledge related to the stroke, diabetes, and the relationship with hypertension. And some of the side effects that would negatively impact adherence, the antihypertensives can cause hypotension, decreased heart rate, dizziness, fatigue, and especially erectile dysfunction, which would make it really hard for people to adhere. The anti-hyperglycemics really just cause weight gain, perhaps, and hypoglycemia. So, importantly, the entire healthcare team needs to cooperate and coordinate the entire program for the patient.
All right, and looking at the staff and other resources that we would need, it's important to get a lower ratio of the staff members compared to the patient. And we want to make sure that the staff's well educated and trained so that they can know, all the pathophysiology, the pharmacology, everything. It's important to relay the message to the patient
let them help determine how much exercise they need or what type of diet they can live